and Brad, the two most famous physical therapists on the internet.
Minus 27 degrees this morning, Brad.
Oh, yes.
Hi, folks. I'm Bob Schrupp, physical therapist.
And Brad Heineck, physical
We're
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Why do we live in a place where the cold, the wind, I just totally screwing this up. Why the wind makes my face hurt.
Bob, because
the air makes my face
we
hurt.
are tougher and strong like bull. We are just tough people.
Today we're going to talk about 5 simple exercises for knee osteoarthritis that you can do at home.
Yep.
These are ones that do some involve equipment and some do not.
Right.
Correct.
Right.
Okay.
So, we have this all the time, don't we? In the clinic, people have arthritis. Oftentimes, say, can you go to the therapist, get some exercises to either prolong before you have a knee replacement or in preparation before you get the knee replacement.
Or after the knee replacement. Some of these are good too. But,
exactly.
And so in some cases, you can extend it for years where you don't have the knee replacement.
Sure.
I mean,
that's the goal.
Yeah, it's amazing if you start getting some movement and exercise in there, the difference it can make.
Sure.
So,
yep.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And we're very proud to say that we've hit 1 million subscribers.
1 million.
1 million.
Very nice.
And you can join us on our social media platforms. Instagram is our latest one. And you definitely want to join us on Facebook, Bob and Brad, because Brad and I have decided, we made the executive decision, we are going to give away something every week for the whole year. Yeah, we're going to be the giveaway channel.
Right, and we're just not giving away trinkets either. We're giving away some good, healthy tips, gifts. Wow. Okay, Bob. So knee pain.
Can we talk about the first thing that we generally tell people?
Right. If you have a flare-up, your knee is hurting you, this is one thing that some people are reluctant to do, but it can be really helpful, and that is pull out the cane.
Yeah, this makes a huge difference. For some people, honest to gosh, all I have them do is this. And they come back and they go, the pain's gone.
Sure.
I mean, and it's not something we're telling you you're going to do on a permanent basis.
Right.
Knee pain tends to flare up and it calms down. And sometimes just by using the cane, you'll get it to calm down. Stop using the cane and it stays calmed down for a while.
Right.
So, and you can use a crutch. A single crutch if you want to look more like an athlete that got hurt. Or, you can use a walker, but anything to help take some of the weight off there.
Right. So, if you are going to do that, we're not going to go through it here, but we have a couple videos on how to adjust the cane and use it.
Right.
Because if it's your right knee, you're going to use it in your left hand. And the sequencing, all that will be clear in the video. The second thing that goes along with this, but not least important, probably equally, is range of motion.
Yeah, you want to start getting some movement in that knee.
Right. And these exercises, like the title says, they're simple. The first thing, I've had a number of knee patients in the last few months work this, and successfully. In a chair, posture, don't be slouching in the chair, get up in good posture.
And Brad, do you mind, when we say movement, we're saying non-weight bearing movement to the large extent if you can.
Right.
So Brad's not putting weight on it and moving. He's sitting down and taking the weight off and moving it.
Precisely. So, and you want to do these, you just don't want to kick your leg. We call these, kicks or long arc quads in the therapy world. You're not just going to kick it out, but with good motion and good controlled motion. So we're going to kick out to here, and you want to try and get full extension. This last few degrees can oftentimes be the most important part of the range. So if you're having a hard time getting up there, you can use that cane that you're walking with in here and pull it up. And that little bit right there, you want to make sure you get, if you can get it, and then down and bring it down to here and work at least 10 of those. Okay, and do those 2 or 3 times a day.
What's nice, you can do this at your office chair or in your living room. I mean, you can, and that's why it's nice, because you can do it anywhere,
right,
at any time, but just nice and controlled. So you start building up that quad strength.
Sure.
So
exactly, getting that range plus some strength, and then also you want to get the knee to bend, and so it flexes as far as it can. This is probably not as important as straightening it, but you still want to get it, and you can, pull your foot underneath the chair. Now, if you got a shiny floor, you can put your sock on, and that'll help so it doesn't drag on the floor so much. You can pull here with your hands and gently pull. Sometimes, if you're comfortable, bring it up into here like that. You can do that, depending on your hips and
Yeah, and really nice.
different.
Again, you can do this anywhere. You can do it throughout the day. And we recommend, in fact, that this isn't something you do once a day.
Right.
This is something you can do. I mean, this is maybe a little exaggerated, but you could do this every hour.
Sure.
I mean, but certainly 3 to 5 times a day.
Yep.
And that's
Yep.
what's going to make the difference. That's when you start seeing the magic happen, when you start getting a little bit of gain
Right.
and strength and range.
Bob, do you want to get the next
Sure.
the next thing? Now, this is a little step up. This is something that helps out quite a bit.
Especially if you're headed towards a knee replacement,
Right.
you're definitely going to want to have one of these.
Right, it's called a knee glide.
Yeah.
We do have it below on our favorite products. We're partial to it because as therapists, we got sick and tired of having people try to do this, especially on carpet at home. It's hard to slide your foot on carpet, and so we do this, and we actually invented this, and it works really well, and it doesn't cost very much. And then you can do some consistent motion, and you do this 2 to 3 minutes. You could go up to 5 minutes, but you're going to get tired. But that's the other thing; it increases the strength.
And generally, what I recommend to people, Brad, is you move it like that. You go ahead and move it and warm it up,
Yep.
and then every so often you'll take the other leg
Yep.
and pull it back.
And
And if that gets too easy, then you go off the toe. You put it on the toe and pull it back.
There.
I have 2 people using this right now, and they're doing it exactly like we just said.
Sure.
And it just gets so much better results than it does on the floor.
Right. Yep. It's a tool made for that. The other nice option it has is you can put it up at an angle like this.
And that works out really well because it's just the way the ankle is angled, and especially with some people, this really makes it a lot easier to do. And you're going downhill now.
Yep.
So
Yeah, when you got a flare up, it's amazing what a little change in resistance or in the angle can make in making
now
your
he's got
progress.
the angle towards going up towards the back, and now he's working the hamstring a little
Yep,
bit more. So
right there. So good. That's a real nice product that can help you out. And like Bob said, especially if you're going to get a knee replacement, because you're going to use it before the surgery and afterwards.
yeah, I just have to tell you a quick story. I have a friend that's my age that got a knee replacement, and I ended up getting him all the stuff he needs. Commode and I don't know, a sliding board and a one of those pickup sticks, or what do you
Leg
grabbers, leg lifts.
Oh, and the
leg lift
yeah.
and a grabber.
Yeah, all
But I gave him the knee glide. He gave me back everything. He kept the knee glide because he still wanted to get a little more range, and it never did come back. So
well,
must be his favorite product.
You bet. Okay,
So-
now the next thing, not just in the seated position, but particularly before you get out of bed in the morning, you're going to be stiff.
Here's a great morning routine for
Those
you.
joints are stiff. So the first thing is just straighten that leg out and see if you can get that little bit. Again, the end range or all the way straight is important. You can pull your toes back, feel these muscles work, and do 10 of those.
Well, I would even say, Brad, you go ahead.
Put
and
a
if
pillow
you,
under the
yeah,
ankle.
if you have a pillow, throw a pillow underneath the heel,
Yep.
and then work on pulling that knee back.
Yep.
That's a great exercise to do. Now you're strengthening the quad and you're stretching it into extension.
Right. So you get an air gap under here so
Yeah.
that you can get full range. Good point, Bob. And then you can also do straight leg
Yeah.
raisers for more strength of the quad and hip flexors as well.
What's nice about that, you're strengthening the knee without putting stress on the joint.
Right.
So you're strengthening the muscles around it, stabilizing it. without hurting
Precisely.
it.
Okay, and then other than that, you want to get the knee to bed. Now, you can do the single knee to chest like this, and you can grab here or here, wherever it works out, to see if you can get the knee to flex all the way to the end and work it like that, and do 10 reps of that as well. Great thing to do before you get moving, just to get that joint ready for weight bearing. If you do happen to have the knee glide, this is where it really shines as well. You want to grab that, Bob?
Hello.
Because if you can do heel slides, and this is one of the exercises I almost always recommend
Right.
after surgery, but you're sliding across, it just
On
doesn't
a
work
bed,
well.
yeah.
Now, if you have this,
And sometimes we even take a towel.
right, because
I
you're
don't know if
probably
you do.
not going to have a shoe on in
If you
bed.
don't have a shoe on, so this just helps to.
Little cushion there, and this is just wonderful. It just slides back and forth like you're on just
On ice.
I was going to say ice, but it's too cold for that.
Yeah, I don't really want to even mention that.
We had minus 29 degrees below this morning where I live. So
oh my gosh.
we're thinking, Bahamas.
And some wind.
Yeah.
There was some wind chill too.
So again, then with that, you can do 10, 20, or 30 reps, whatever it takes. And it's exercising the muscles plus working the knee. You're going to feel much better when you get up and start walking around. So, Bob, what say you?
I think that's covers it, Brad. And the key is getting some motion. What you may not realize is that your knee kind of produces a synovial fluid, which is kind of like a lubricant.
Exactly.
And it produces it when there's movement. So that's why the movement is the key to trying to get this knee pain to calm down. So,
joints love the move, Bob.
That's right.
Keep them moving and they'll be happy.
All right, let's move on out.
Wow, Bob.